Introducing the Cryosuccess Liquid Freezing Unit. This Swiss-made cryotherapy device provides professionals with a new, efficient and effective mobile solution for treatment of a variety of skin lesions. This technology is convenient, accurate, clean and economic, removing the need for constantly evaporating liquid nitrogen or cumbersome machines and methods. The device can be used in various specialities. It allows direct contact between the glass tip and the skin and causes tissue necrosis by generating a constant penetrating temperature of -89 degrees Celsius. The Cryosuccess is built strong with a comfortable and ergonomic design, resulting in quicker, more accurate treatments. The interchangeable tips are available in a range of innovative sizes for different applications. The Cryosuccess uses medical-grade nitrous oxide. The unit features 2 built-in permanent filters which do not require changing. The large 23.5 gram cartridges do not leak and have a shelf life of 5 years. Each cartridge delivers a treatment time of approximately 300 seconds, making it an economical option for many practices. To assemble, take the unit in your hand and put the stabilization pin in the intended hole in the unit's body. This helps to grip the body without damaging the lever. Screw the cartridge in a clockwise direction quickly and fully into the body of the unit. Make sure to align the cartridge straight and never force the thread. You will feel a hard stop when the cartridge is fully attached. No noise of escaping gas should be heard in this process. Ensure your selected tip is firmly tightened and the device is ready for use. Holding the unit as you would a pen, with your index finger on the lever, place the tip on the center of the skin lesion. Direct contact with the skin is mandatory. The unit will work best from vertical to 45 degrees. Never use the pen horizontal or upside down. Simply apply direct pressure and press the lever to achieve your cryotherapy burn. For treatment lengths for various conditions, see our recommended application times list. The Cryosuccess comes into its own when treating skin lesions around the eyes and other sensitive areas due to its pinpoint accuracy and minimal spray, which has next to no effect on the surrounding area. It is recommended practice to store the unit with the cartridge fully attached until all the gas is used. Due to the inbuilt safety release valve, it is safe for the practitioner to remove the cartridge even if some gas remains. You may hear a small hiss when disconnecting. This is expected and safe. The tips of the Cryosuccess unit are easily interchangeable. They can be cleaned and disinfected with a simple disinfectant or alcohol wipe. However, if the tips have come into contact with blood, mucus, or an infected area, the tips must be sterilized prior to reuse. Once tips are removed from the unit, they can be sterilized in your B-class autoclave, as they will not expand or collapse with changes in temperature. After cleaning, replace the tip cap and easily store the Cryosuccess until next required in its handy protective transport and storage case. If you are not getting the desired results during your cryotherapy treatments, pause this video now and try the suggested solutions on screen. Additional tips and cartridges are also available for purchase separately. The Cryosuccess Cryotherapy unit has a 2-year warranty and comes in deluxe or standard kits.